My name is Kate Girard, and I am the Montana State WIC Director. Today, I'll be providing an overview of an exciting project that we have been working on with our partners. The Montana Nutrition Access Project, or MTNAP, is a collaborative effort to address food insecurity among young children and families. A major element of this initiative includes co-locating WIC services with pediatric or mother-baby units in several Montana cities. WIC and Montana providers involved in the project are excited to see how the pilot sites improve access to WIC, streamline services, and provide an opportunity for us to work more closely in our referral systems. Another element to this project is to educate providers about food insecurity using validated questions for screening at well visits and effectively making referrals to WIC, SNAP, and food banks. The Montana chapter of the American Academy of Pediatrics, as well as the Montana Food Bank Network, have grants to support this work. We have also engaged YARO Public Health Consulting for planning and evaluation. Other partners and stakeholders include the Healthy Montana Families Home Visiting Program, Head Start and Early Head Start, No Kid Hungry, and others in developing a collective impact framework. To provide some context for the project, the next several slides include some data about food insecurity in Montana, as well as participation trends in WIC specifically. This graph shows the number of people in Montana living in food insecure homes. Like the rest of the nation, WIC in Montana has seen a steady decline in participation over the last decade or so. This chart shows two trends that are of interest: the percent of infants and children in Montana who are potentially eligible for WIC, according to a match with census data. And then within the bars, you'll see the percent there of those who enrolled. Similarly, this slide shows total births in Montana from 2011 to 2019, and the percent of those infants that enrolled in WIC. Again, this essentially shows the steady decline and underutilization of WIC. We're still in the midst of planning. However, some successes have already been seen. First off, Montana WIC and pediatricians are connected and working together to learn about and address food insecurity in Montana. We have developed tools that can be used at our pilot sites and beyond to streamline the screening and referral process. And lastly, Kylie Bodley and Dr. Shana Rogers, who are our partners in the Montana Academy of Pediatrics in the project, have joined the Food Security Council. This will provide ample ongoing opportunity for networking and collaboration to address food insecurity. We hope to have our WIC clinics co-located, or at least improving our referral system and enrollment remotely in the next month or so. We are finalizing the evaluation plan and metrics to be tracked for the project, and we are continuing to meet and share updates, including lessons learned. Once we have our pilot projects wrapped up, we hope to expand the service delivery model around the state and include telehealth as a regular option for WIC. We've seen throughout the pandemic that that option for telehealth and remote services has been very popular amongst our participants. It's made the program much easier to access, and we sure hope to continue that ongoing. Thank you for joining today. I look forward to any questions and discussions about our project.
Hello, my name is Lindgren, and I am the Health Advocacy Manager with OneHealth. I'm here today to talk to you about integrated care model combining medical and behavioral health to address food insecure patients. I would like to point out OneHealth's mission, which is that we believe in improving the well-being of everyone by providing accessible, quality healthcare for the whole community. Many would ask, what does integrated healthcare mean? Integrated healthcare, often referred to as interprofessional healthcare, is an approach characterized by a high degree of collaboration and communication among health professionals. Whole health is an approach that considers multidimensional aspects of wellness. It encourages individuals to recognize the whole person: physical, mental, emotional, social, intellectual, and spiritual. This next slide shows where we have our OneHealth centers, and those are located in Chinook, Hardin, Harlem, Miles City, Ashland, Lewistown, and Glendive. This next slide, which the data is from 2020, shows who we serve by race and by insurance status. 71% of our population is white, 24% is American Indian or Alaska Native, and Those we serve by insurance status. I'd like to point out that 33% of our population is served by Medicaid. Our food insecurity pilot project uses PREPARE screenings, which is a healthcare screening. They're conducted to identify social determinant of health needs. Now, those social determinant of health needs are those non-medical needs that impact a person's health and well-being. Those patients that are identified with social determinant of health needs are referred to community health advocates. They help to locate those resources in the community that would help to mitigate those needs. We are giving our patients a $25 food voucher to patients that have a positive food insecurity screening. Those vouchers can be used immediately, meeting the food insecurity needs of those families with children under the age of 18 in the home. Vouchers preserve autonomy of choice while reducing that stigma that's so commonly associated with food insecurity. Our project partners are local grocers, bringing an added revenue to the community. How do community health advocates address need? Well, they meet with the patient, sit down and talk to them and find out what things that they need in their life. In many cases, they will help a participant apply for SNAP if they aren't already on the program. They're also provided with a list of resources for their particular community. And we've often offered them a shopping tour on how to shop on a budget. And we give them a cookbook on how to eat on a budget. Now this slide shows a flyer from our pilot project in Hardin with MSU Extension and First Interstate Bank. This project is a 7-week class series. 6 weeks of the class focus on cooking and nutrition, and the 7th focuses on financial education with First Interstate Bank. The impacts of our pilot project to date, 137 unique families have been assisted with food vouchers. 39 of those families are returning participants. 6 families have completed the cooking and nutrition classes with MSU Extension, and 10 families have applied and are receiving SNAP benefits as a result of meeting with a community health advocate. Thank you for having me here today, and I look forward to answering any of your questions.
My name is Kim Lloyd, and I am the new Harvest of the Month Community Coordinator with St. Peter's Health in Helena. I'm excited to share how we are improving education and community health outcomes through the Harvest of the Month program. The Kids Nutrition Coalition, a MT-PECH member addressing nutrition insecurity in Lewis and Clark County and surrounding communities, identified that there are limited opportunities for nutrition education and access to local and nutritious foods in the Helena area. When Food Corps was no longer an option in Montana, the Kids Nutrition Coalition partnered with one of the largest health advocates in the community, St. Peter's Health, to help find a solution. I am part of St. Peter's Health Population Health team. Population Health recognizes the need for upstream population level work, both in and outside of the hospital. This includes strong collaboration with community partners to increase available resources as prevention for chronic health conditions. A tool already created to help address these needs is Montana Farm to School's Harvest of the Month program. By following a calendar featuring healthy, whole Montana-grown foods such as beets, lentils, and bison, we can provide monthly nutrition education lessons and taste tests of locally procured food. Materials are available for K through 12, early education, healthcare, and businesses. Another feature of this program is to work with these institutions to increase opportunities for local food procurement to increase general impact. A Helena Harvest of the Month work group meets once per month as a steering committee to address needs and determine next steps. Partners include Helena Food Share, Helena Community Gardens, Rocky Head Start, Helena Public Schools, Lewis and Clark County SNAP Ed, Montana Farm to School, and NCAT. We report our program successes and measurements back to the Kids Nutrition Coalition. In the first 4 months of this program, we have established Harvest of the Month as a 4th grade program in 6 elementary schools, the Helena School District, and 1 in Montana City. We are able to expand our reach by recruiting high school culinary students to help teach lessons. Myself and 4 high school students are currently visiting 16 classrooms once per month to provide a 30-minute nutrition education lesson followed by a local food taste test. This is 13 classrooms in the Helena School District and 3 in Montana City. And this is really the most unique opportunity of this program, that we have high school students helping to mentor elementary school students, a really great feature and something the administration really admires. Utilizing Montana Harvest of the Month simple voting metric, we asked students whether they tried, liked, or loved the local food tasting. By recording votes, we can track number of students participating and also send our results to District Food Service Director for menu inspiration. In the month of January, featuring local carrots, we opened class asking students if they like carrots. While we started off our lesson with not many students raising their hands, by the end of the lessons, after 281 students participated, we had 47 say that they tried local carrots, 49 said they liked them, and in the majority, we had 185 voted that they loved the local carrots. We look forward to collecting taste test results for beets throughout the month of February. It's exciting to be in the preliminary stages of this program. Harvest of the Month is not a new program to some of our partners, but working together will ensure we are expanding our reach and community buy-in. We hope to expand to additional schools and include garden and farmers market programs for the larger community. Recent supply chain shortages have emphasized the benefits of purchasing local foods, and we will work with our institutions to help make that an easy choice. We will continue to look at what has been successful in other communities around the state, yet build something that is unique and sustainable in our community. This is a team effort, and having the hospital behind the project has really helped bring strong partners together for a common goal of ensuring our community has the access and education needed to help encourage a healthy lifestyle. Please let me know if you have any questions.